According to a 2003 government health survey, 7.4% of men and 4.5% of women in England are likely to suffer from a heart attack. The figures show a steadily increasing risk with age, until by the age of 75, 1 in 4 men and 1 in 5 women are at risk. Treating heart disease can be expensive and traumatic for the patient, involving major surgery and a lifetime of drugs. Early detection and intervention can therefore save lives and money. That's the promise of a new test for heart trauma developed here at the University of Leicester.
At the moment, we tend to treat everybody that comes in through the hospital doors with heart attacks in a very similar way. We give them all the same sort of treatment. So in future, we may be able to assess the patient's risk so that if we know that the patient is at high risk, we can escalate that treatment to a higher level and perform more invasive procedures earlier on, before events happen.
The Leicester team were among the first in the world to recognise the importance of a peptide or protein, naturally produced by the heart when stressed. They found that the amount of the peptide present after a heart attack is a good indicator of the severity of the damage to the heart and the likelihood of further attacks.
Using these proteins coming from blood called the B-type natriuretic peptides, these are specific proteins that come from the heart, and they can be used in this situation after a heart attack to predict mortality. They have an accuracy which exceeds that of clinical examination, and that's where we've focused most of our activity, to look at the ability of these proteins to predict death and also to predict re-hospitalization with heart failure.
What's more, the team found that the peptide test could even detect heart stress in patients that had shown no symptoms of heart problems, opening up the possibility of reducing their likelihood of heart attack through early intervention.
We've shown that you can use this B-type natriuretic peptide to actually screen for heart failure. Now, because of the prevalence of heart failure, the number of people with heart failure in the community is very small. They're quite difficult to detect, and as many as half of these people in the community will not actually have symptoms of heart failure. And the only way they can be detected with heart failure at the moment is by doing what we call an echocardiogram scan, a scan of the heart, a bit like the sort of baby scans that people have when they're pregnant. You can do a scan like that on the heart and look at heart function. And obviously this is a very, very intensive sort of test and quite costly to do. So by using a simple blood test, it is possible in future perhaps to screen for people with heart failure in the community.
The team is now working with a commercial partner to develop a simple device that could test for the peptides in a normal doctor's surgery and give an accurate result in just minutes.